Hey, it's Zitty. I thought you guys might be interested to see what I do in my other life. So come on and help me with some chores. I've got my Great Dane with me and our rescue pit bull. She's a sweetheart though. She's an absolute sweetheart. My daughter picked her out of like hundreds of pit bulls. Anyways, I've got to feed the chickens every day because I've got this animal problem. A rodent is burrowing under the chicken coop. And I don't really know how to get rid of it. I can't stop it. Every time I put like a barrier up, it digs underneath it or around it. So anyways, I'm feeding the chickens every day, which, you know, isn't really a horrible job. It's kind of fun. The chickens all have personalities. It's really fun. There's a lot of drama out in the chicken coop though. A lot of drama. So, hi girls. Funny, they get used to certain things like you know, my big Great Dane, they'll walk underneath them no problem, and a new dog comes around, they're like, nope, time out, no way. Come on, let's see if there's some eggs in here. So it's a lot of work, and this is what you would do it for. Oh yeah, hey, look, take a peek. Yeah, we've got 4 eggs in this one and a couple in this one, so they're doing good for me right now. So, you know, they slow down in the wintertime. But this is the easy chore. I got a Great Dane, so that means a lot of food in and a lot of poop out. So I got to pick up the yard. So, oh, let's go do that right now. Dog poop out there. It's like never ending. Pick up stick time. One more thing before Jackie comes, because I've got a great little exercise program for us today. We got to feed the wild birds. So hey Jackie.
Hi David.
He's about twice as big as you.
He's a big guy.
He's a big lover. So, you know, I was going to show some folks some hip and knee exercises. Know anything about that?
Hip and knee exercises? I just happen to have been a orthopedic hip and knee nurse for a long time. I know.
Can you guys believe that? I mean, I'm interested in hip and knee, and Jackie is an orthopedic nurse for hips and knees. I mean, come on, seriously?
Yeah, I know.
I mean, what's the coincidence of that happening?
It's what I know. It's really what I know.
So let's go to the gym. And let's show these folks some really great hip and knee exercises that can take pain away, can maybe help you with a replaced joint that you already have, or even prevent from getting a replacement joint.
Keeping your knee and hip strong is the key to everything, even if you don't have a joint or if you do have a total joint.
Okay, let's do it. Before we get started, let's do a minute of cardio.
I'm ready.
I'm gonna get on a bike. Jackie, you're gonna do a clean and press today, aren't you?
I'm gonna do 2-arm clean and press. Our minute starts.
Okay, we're looking for about a 60 to 70% effort. That just means after a minute, yeah, I'm breathing a little bit, but I can still talk to you. I love these Airdynes, by the way.
Do you?
Oh, I do. Yeah, they'll suck the air right out of you. Did you know that every day is a good day for a workout?
Yes, I did know that.
I know you did.
Every day is a good day for a clean and press.
Hopefully you are watching us and saying the same thing, that every day you can get something in. Jackie, I'm so happy you're here with me today because you are an expert on hips and knees.
You know, I know a little bit about hips and knees.
I know you do.
I've been an orthopedic nurse for longer than I'd like to admit, you guys. And I've talked
She looks very young.
Lots of patients through hip and knee arthritis and then hip and knee replacement. And the key to the best result?
That's it. Is what?
Exercise.
You got it. It's exercise, isn't it? You know, any kind of exercise at home would be good. Step-ups, just doing some standing in place, running around your house a little bit, just a little bit of heart rate, gets your blood into your brain, and then anything we do is going to be improved.
Yeah.
All right, so I love these. This is called a wall slide. We're gonna pin your hip, knee, and foot against the wall. It's like someone's pushing you all into the wall. My arm's tucked behind me, and I'm just gonna raise my leg up and back down. Hey, it's nice to see you, Jackie.
Hey.
Imagine this, we're just hanging out on the wall together
You
again.
look a little bit taller when you're on the wall. It's physically possible.
So I'm trying to get my hip against the wall, my knee, my foot, everything's getting shoved in there. If you can't get the foot against the wall right away, don't worry about it, you'll get there.
Wow, this is a great strengthening exercise.
We're gonna do 10 today. So I think that's 9 and 10. Great. Let's flip, we'll do the same thing on the other side, unless you just want to be strong on one side. Here we go. You ready?
I'm ready.
Pushing your hip, pushing your knee, pushing the foot. You know, when I first started this exercise, I thought, okay, I'll feel it on the leg that's moving, but I actually feel it on the leg that's down too.
I do feel it on both legs.
Both sides, yep. You're just coming up as high as you can. Doesn't matter about speed. I want you to feel like you're warrioring out a little bit.
You know what folks have told me is, I just don't know why I limp. You know what, this is an anti-limp exercise. It's getting me
Exactly.
stronger.
Last one, Jackie.
Got it.
Good. You know, I love teaching exercises that you can do anywhere.
Yeah.
I mean, you can take these on vacation with you. You can do them in your house. You can do them anywhere. This next one's the exact same thing. We're gonna do this anywhere. It's called a one-legged squat. I've got a zitty stick here for you. We're gonna stand on one foot and put a foot against the wall. So my leg that's down, I've got a leg that's against the wall. I could be hanging onto a chair or something like this. We're gonna bend the knee and we're gonna sit against the wall. When I sit against the wall, I like to put my butt and shoulders against the wall. And then we're gonna stand back up. So I'm actually bending this knee a little bit and sitting against the wall. You see how our eyes, we're always looking at you the whole time. Yeah, I can see your eyeballs. There we go, that's perfect, nice. Yeah, this is kind of a tough one. So the deeper you go, the more you get out of it. Your other leg can be as low or as high as you need it to be. You can even put a toe on the ground if you needed to. The whole idea is that we're weighting this leg. Feeling a little bit worn out?
I'm getting stronger.
Okay, that's 10. Let's do the same thing on the other side. Now, if you don't have a stick, or you don't have a zitty stick, get one, because we'll be talking about that some other time. But you can do it without. That's the whole idea, is that this leg's spotting you, okay? And again, if it's on the floor, just toe on the ground, and we're coming up and down, okay?
And it doesn't matter how far down we go?
No. I like just a bend in the leg, and that's really gonna hit this glute. See, we're strengthening your glute right now.
It's all
That's
about
what's important.
glutes.
All about glutes. Maybe we should write a book saying,
Thanks.
all about glutes. Let's call that 9 and 10. Good. Okay, nice job.
That's good.
If you need a little break, take a break, hit the pause button.
Grab some water.
We're gonna do a walking drill right now.
Okay.
It's the cowboy walk, and you know all about the cowboy walk.
The cowboy walk.
So we're gonna bring the toe in and then back out. So it's like you're drawing a circle on the floor. Around and around. You don't need a whole lot of space for this one because we're just not getting very far. It's not about taking a big step. It's about drawing a circle on the floor with your toe. Nice, good. And can you hang on to someone? Sure, we can hang on to someone.
Yeah.
Absolutely. Or a stick, or a zitty stick, or a cane or something. Perfectly fine. Or you can do this along your kitchen countertop. Okay, so what goes forward can also go
backwards.
Thank you. So we're gonna go in and then out. In and out. In and out. Again, we're really not getting very far per step, but we're just trying to rotate that femur, because the femur is a ball and socket joint. And so we want to rotate it in that ball and socket. And that's exactly what we're doing right now. Good for replaced hips, good for hips that need replacements, or just good for everybody.
You know, this move, this circular move, targets every muscle that supports the hip joint.
Love that move. Okay, so this is one of my favorite things to do is perfect walking.
Perfect walking.
Okay,
Yeah.
Jackie, will you follow me around? I
You
want to
got
show
it.
everyone what perfect walking looks like. So my chest, there's a rope attached to my chest and it's pulling me up and out. All right, my chin is up, my chest is out, and let's go for a little walk.
Let's do it.
So I just try to walk as perfectly as I can. And anytime we do a practice walk like this, you can exaggerate, okay? You can exaggerate, all right? We'll just do a little one here, okay? And you can just walk around your house a little bit like this, because everything that you put into your brain comes out improved. Okay, let's do one stretch, all right? Let's do a calf and Achilles stretch. And we're gonna do this against the wall. So my back leg is straight and my heel's on the ground. I'm gonna lean my hips towards the wall. And my back leg is straight. I'm stretching my calf muscle right now. Now we're gonna bend that back knee. And that drops the stretch to the Achilles. Okay, so straight leg stretches my calf. Bent leg stretches my Achilles. Nice. Hopefully you're feeling this all the way down here somewhere. Nice, yep. Oh, I love this stretch. It's called an old runner stretch. We bend the knee for Achilles. We can hold for about a 10 count. Good, and then straight leg stretches your calf. Lean your hips towards the wall, and then bent leg stretches your Achilles. So, thank you so much for joining us. Please try those every single day if you can, and hopefully your hips and knees will feel better.